The year was 1918, a time when the world was in turmoil. The world was engulfed in the throes of the Great War, a conflict that had drawn in nations from every corner of the globe. This war had ravaged nations and shattered lives, leaving behind a trail of destruction and despair. Yet, amidst the deafening roar of cannons and the stench of mustard gas, a new and insidious enemy emerged. This enemy was silent and invisible, but far more deadly than any weapon of war. It was the Spanish flu. The Spanish flu pandemic would leave an indelible mark on human history, claiming millions of lives in its wake. In the spring of 1918, as the war raged on, soldiers fought in muddy trenches, unaware of the new threat that was beginning to spread among them. An unfamiliar illness began to spread, starting subtly like a common cold, but soon it morphed into a terrifying monster, claiming millions of lives with alarming speed. The world, already grappling with the horrors of war, was ill-prepared for this new threat. Hospitals overflowed, medical supplies dwindled, and fear gripped the hearts of millions. The virus respected no borders, no social class, no age. It swept across continents with terrifying speed, leaving a trail of devastation in its wake. Hospitals overflowed, medical supplies dwindled, and fear gripped the hearts of millions. The world watched in horror as a microscopic enemy threatened to unravel the very fabric of civilization. The virus respected no borders, no social class, no age. It swept across continents with terrifying speed, leaving a trail of devastation in its wake. It swept across continents with terrifying speed, leaving a trail of devastation in its wake. Leaving a trail of devastation in its wake. The world watched in horror as a microscopic enemy threatened to unravel the very fabric of civilization. The name Spanish flu is a cruel irony, a historical misnomer that has persisted for over a century. Contrary to what the name suggests, Spain was neither the origin of the virus nor the country most severely affected by it. The name arose from a quirk of wartime censorship, a peculiar twist of fate during the chaos of World War I. While other nations, embroiled in the Great War, suppressed news of the outbreak to avoid damaging morale and maintain public order, Spain, which remained neutral in the conflict, freely reported on the disease, providing detailed accounts of its spread and impact. This extensive reporting gave the false impression that Spain was the epicenter of the pandemic, leading to the enduring misnomer. The actual origin of the virus remains a mystery, shrouded in the mists of time and obscured by the fog of war. Some scientists believe it emerged from Kansas, where the first known cases were reported among military personnel. Others point to China or France as potential origins, citing various historical and epidemiological evidence. Regardless of its birthplace, the 1918 influenza virus spread with unprecedented speed and ferocity, overwhelming healthcare systems and devastating communities worldwide. The pandemic forever altered the course of human history, leaving a lasting legacy of loss and resilience. The Spanish flu spread like wildfire, fueled by the very forces that defined the 20th century globalization and war. Soldiers, crammed into trenches and transported across continents, became unwitting carriers of the virus. The constant movement of troops provided fertile ground for the disease to spread, quickly overwhelming the limited medical resources of the time. From the battlefields of Europe, the virus traveled aboard ships and trains, reaching every corner of the globe. Cities became epicenters of infection, with crowded conditions and poor sanitation accelerating the spread. No one was immune, young and old, rich and poor, all fell victim to the invisible enemy. The virus did not discriminate, leaving a trail of grief and despair in its wake. The Spanish flu was a particularly brutal strain of influenza. Unlike seasonal flu, which typically affects the very young and very old, this virus struck down healthy adults in the prime of their lives. The symptoms were swift and merciless. What began with a headache and fever quickly escalated to debilitating muscle aches, chills, and a hacking cough. Many victims developed pneumonia, their lungs filling with fluid, leaving them struggling for each breath. The skin of some patients turned blue from lack of oxygen, a chilling testament to the virus's devastating power. Doctors, overwhelmed by the sheer number of cases and armed with limited medical knowledge, were often powerless to stop the disease's deadly march. By the time the Spanish flu pandemic subsided in 1920, it had infected an estimated 500 million people worldwide, 1/3 of the global population at the time. The death toll was staggering, with estimates ranging from 50 to 100 million lives lost. Entire families were wiped out, leaving behind a void of grief and despair. The pandemic crippled economies, decimated workforces, and left societies reeling from the trauma. Hospitals overflowed, businesses shuttered, and public gatherings were banned in a desperate attempt to halt the spread. The world was a changed place, forever marked by the shadow of the pandemic. Section 6. Echoes of the Past. Lessons Learned. The Spanish flu pandemic, despite its horrors, taught humanity invaluable lessons about public health and the importance of global cooperation. The need for effective hygiene practices such as hand washing and mask wearing became abundantly clear. The pandemic also highlighted the vital role of public health infrastructure in preventing and managing outbreaks. The world witnessed the devastating consequences of inadequate healthcare systems and the importance of investing in research and development of vaccines and treatments. The echoes of these lessons continue to resonate today, reminding us of the importance of preparedness and global solidarity in the face of public health threats. Section 7. The Indomitable Spirit, Humanity's Resilience. In the face of unimaginable suffering, the human spirit endured. Doctors and nurses worked tirelessly, risking their own lives to save others. Ordinary citizens stepped up, volunteering their time and resources to care for the sick and comfort the grieving. Communities came together, offering support and solace to those in need. The Spanish flu pandemic, for all its devastation, revealed the inherent goodness and resilience of humanity. It showed that even in the darkest of times, hope, compassion, and the will to persevere can prevail. The pandemic served as a stark reminder that we are all interconnected and that our collective strength lies in unity and cooperation. Section 8. A legacy etched in time. The Spanish flu pandemic may have faded from living memory, but its legacy continues to shape the world we live in today. It serves as a constant reminder of the devastating power of infectious diseases and the importance of public health preparedness. The pandemic led to significant advancements in virology and epidemiology, paving the way for the development of vaccines and antiviral medications. Moreover, it highlighted the need for international cooperation and data sharing to effectively combat global health threats. The lessons learned from the Spanish flu continue to inform public health policies and pandemic preparedness strategies around the world, ensuring that future generations are better equipped to face similar challenges. Section 9. A call to remembrance and action. As we navigate the complexities of the 21st century, the story of the Spanish flu stands as a stark reminder of our shared vulnerability. This pandemic, which swept across the globe in 1918, claimed millions of lives and left an indelible mark on history. It is a call to remembrance, urging us to honor the millions of lives lost, the healthcare workers who risked their lives, and the countless others forever changed by the pandemic. Their stories are a testament to human resilience and sacrifice. The Spanish flu not only brought immense sorrow, but also highlighted the importance of preparedness and the need for robust healthcare systems. But it is also a call to action. We must remain vigilant, investing in scientific research, strengthening public health infrastructure, and fostering global cooperation. These steps are crucial in preventing future pandemics and ensuring a swift response when they occur. We must learn from the past, understanding the lessons it offers, and applying them to our present and future. By doing so, we can build a world that is better equipped to handle health crises. By learning from the past and working together, we can strive to create a healthier and more resilient future for all. This requires a collective effort, transcending borders and uniting humanity in a common cause. The Spanish flu may have been a tragedy of unprecedented scale, but it also illuminated the enduring strength of the human spirit. It showed us that even in the darkest times, there is hope and the possibility of recovery. But it also illuminated the enduring strength of the human spirit and our capacity to overcome even the most daunting challenges. Communities came together, supporting one another and finding ways to adapt and survive, and our capacity to overcome even the most daunting challenges. As we reflect on this chapter of history, let it inspire us to build a future where we are better prepared, more compassionate, and united in our efforts to protect and uplift one another.